Hi, everyone. This is Dr. It's been a minute. I know I've been AWOL, but I'm here. So it's been over a year now. I've been an independent GP. If you all remember, I was an ST3 in 2024 when I just passed my SCA exams, which is exam GP's rights to exit their training. And since then, I've been employed by my training practice where I have been for over a year plus now. I'm almost getting to 2 years since I became an independent GP. So, this session today is just to talk about something we don't talk about a lot, that is transitioning from a trainee to an independent GP. And I'm here to tell you a few things I have learned from my own experience. So, let's get going. Obviously, becoming an independent GP is very exciting, but it can also feel very overwhelming. And I think we should talk about it. And I want to use my platform to talk about it. So, the transition is huge. The workload is real, and expectations can be very unclear. Obviously, you know that. I know you work in practices, but most people expect that you should be as good as a GP with 10 years experience because that is what it is. As long as they're paying you money at that point, you're no longer just a trainee or a GP who just finished, a year ago or a few months ago, to say the least. So now, with the right tools, planning and mindset, you can not only cope, you will genuinely thrive. Because I'm here to tell you, I have been thriving so far, so good. Today, I'll walk you through practical, realistic steps to protect your well being, your confidence, and your long term career satisfaction. Right. So, the first thing I'll tell anyone is have a work plan before you start. People fall into the trap of taking any kind of contract because you've seen other people in the practice doing the same thing and you feel I should probably just fall in line. You don't have to fall in line. You don't have to. While my personal experience in my own practice, right, for over a year, as a GP, I had a different work plan to the rest of them. But before then, they've had trainees who transitioned into the GP life in my practice, and they just placed them on the usual 10 minutes, endless patients, and just didn't really have a clear-cut admin time. And most of the work they had to do in their own time. So people were leaving quite late and all that. I saw that and I knew that I wasn't going to be there. Thankfully, with the support of my trainer, who is very knowledgeable, he told me, make sure you settle on a plan before you start working, because once you start working, it becomes difficult. And at that point, you'll be seen as someone who is very difficult to work with. So I took that advice and I said, yes, I'm going to make sure I have a clear plan. So what can your clear work plan look like? Make sure you plan before you sign anything. So if you trained with 15 minutes appointment, maybe when you were training, when you were about to leave training, you were on 15 minutes or 20 minutes, whatever, but 15 minutes usually is standard at ST3. Please don't accept 10 minute slots for patients. And I know people say, oh, they give them 10 minutes and give them catch-ups, but it's still at the discretion of the practice. I personally wanted a work plan where I could do 15 minutes for each patient. And after 6 patients, I have an admin slot. And then that means per session, I see 12 patients. So that was what I agreed on. Most people in my practice don't work that way. They get more patients load, but maybe they don't want to speak for themselves. And yeah, that's it. So anyway, so you don't have to just jump into 10 minutes slot, because even though you're a GP now, you still don't have a lot of experience. You're still trying to, understand the terrain. So you need every time you can get. Now, you have to be very clear on how many patients you're expected to see, what a session actually means, because some people's session is 4 hours, some people is 3 hours, 10 minutes, and you need to know exactly what it means. Don't just assume, right? Assumption is the mother of all fuck ups, right? So you need to know whether these numbers you're seeing are flexible, because if you do have, say, a medical student with you or you're supervising, that should also change. It shouldn't be a static number, right? You need to know how to speak up for yourself. Though right now, you're not supposed to just be a gullible, say yes fellow. You're not looking for people to like you. You're not sliced bread, please. Thank you. Anyway, so you need to know what kind of admins you get and for what. If you are assigned like the document and all that, you need to know what time does it fit in, because you don't expect to have like over 150 documents or 20 or 30 and have the same time. Do you understand what I mean? You need to ask them to know how many are you meant to do per session, and do you have the time to do it? Because I do get people complain in my practice, oh, this, da da da. They want me to do this at my own time. I'm like, you don't have to. You don't have to. But here we are. It's not you being difficult, right? It is you ensuring patient safety and your own sustainability. Because let me tell you something. If you drop tomorrow, they are getting another GP. Nobody cares, right? So please fight for what is right. Now, you also need to know what is safe for you. The BMA recommends 12 patient contacts per session and usually around 25 contacts per day. And it can be less depending on the complexity, because now we're seeing more complexity in general care, in general practice, and we can't just pretend that all of them need 15 minutes, right? Because the patient who has communication difficulties and brings an interpreter or translator doesn't need 15 minutes. You need more than that. If you're doing some other procedures, you need longer. So it all depends on the complexity. If someone is coming with 2-3 complaints to see you, doesn't mean that at that point they have to use 15 minutes, because you now have 15 minutes. That means you can entertain more than one problem. No, one appointment, one problem, unless it's something you can manage, right? Right. So also make sure your rota includes admin time, home visit time, time for referrals, that all of this is in your admin time, and the blood results, the queries, and all that. So knowing that admin is a clinical work, don't let it creep into your lunch or evenings by default. Please, they don't used to give cup for people who leave late. They will not remember it in one of your eulogies. Being a smart worker means you have to leave your work at the time you're meant to leave your work. You don't leave your work 2 hours after. That means you're not efficient. That's what it means. It means you're not efficient, because everybody has a work. Everybody knows what they're meant to do. If you're leaving work late, then there's a problem. They always feel there's a problem with you. So that means for you not to leave work late, you need to make sure that everything is working the way it's meant to work. You're not supposed to take on extra responsibility that you're not being paid for. Sorry, I'm one of the advocates of I do what I'm being paid for. If you want me to do more, then I've got to get paid for it, because the more I'm taking the time for my personal life to put in here and it doesn't translate to money, I don't know what I'm doing here, because these bills won't pay themselves. Let's be factual. Let's be honest. Let's just stop pretending. We love our patients. We care for our patients, but you need to be an effective person. If you die tomorrow, sorry, people move on. You can't keep selling your family crap. The time you're meant to be with your kids, you can't be with your kids, and you're working and it doesn't translate to extra money or extra income to the family. So what are you really doing? I don't know. Protect time for your admin and home visits, right? That's it. Right. So another thing you need to do is prioritize your personal development. This is very important, because I've seen many GPs, you just become a GP and the skill, you just maybe keep seeing the same thing and you're not challenged. It can really happen. So we're changing the game. GPs are knowledgeable. GPs do a lot, So you don't want to become the kind of GP who is outdated, unconfident, sending every patient to the A&E because you feel unsure. Make time to read. We'll discuss difficult cases. If you have a practice meeting with other GPs, you guys talk about, challenging cases. Talk to your friends. Read the latest guidelines. Be really, really updated. Learn from your colleagues. Reflect on your consultation. Ask questions. Your instinct sharpens when your knowledge is fresh. So all those patients you see, someone is like, no, I won't send them to A&E or, acute emergency care unit, all those sort of, because I'm sure it's nothing serious. This patient can actually be investigated as an outpatient. This patient is safe to go home. Things like that. You need to build that skills, and it only comes from knowledge. Is not just by experience or apprenticeship like they're making us believe now. That's why they can. Let's not go there. But whatever, you need to, the only reason why you know what you know is because you're updated in the guidelines or the latest happenings. It doesn't have to be some curated guidelines that most people are not even updated and they just produce things because it works. I mean, like actually good updates, and also make sure that you are, taking all these in, applying it to your patient, making sure your patient has the best possible outcome, and learning from your own, things that didn't really go well. You reflect on it, be better. But there is no knowledge without reading. Do you understand? Knowledge comes from what you have internalized by reading and also your experience. That's how it works. You're a doctor. You are the person who needs to have the knowledge so your patients can actually trust you. That's how it works, right? So another point is build your skills and portfolio. Think about where you want to go, where you want your career to go. Do you want to do joint injections? Do you want to do minor surgery, medical education, lifestyle medicine, things like that, women's health? You need to know what you want and know where to get it from. If your surgery is funding you to go do minor surgery or you have to do it out of your own pocket, something I can tell the ST3s is that you can use your study budget and get the joint injection done, because most surgeries won't pay. My surgery won't pay for my further education. So thankfully, I joined the fellowship and I had a study budget and I paid for my minor surgery and my joint injections. So you can take advantage of your study budget now as a trainee before you become an actual GP. So that's what I would advise you to do. So you need to decide what portfolio you want as a GP. Do you want to be a bit of everything? I personally like a bit of everything, but there's some things I don't like, right? So I've done my joint injection, booked for a minor surgery. I'm also interested in medical education, but I'm still open to learning. I'm someone who loves to get everything, just like a sponge, just try to soak up everything. So if you're not my kind of person, you like to narrow in and zero in on one thing, please do. And again, some people go to like PCNs or they practice and decide an area of need and then fill the need. So if they maybe want to establish a vasectomy service, you can volunteer. They take you on the course, they train you on the course, and then you can establish the service. The world is your oyster. So if you realize they are struggling with one thing, maybe diabetes, or say now they're about to start GLP-1 agonist injections in primary care, you can volunteer to run the service in your surgery, and help them get something very smooth and running. So all of that depends on what you want to do. You need to discover what you want and then work towards it, because if you don't, nobody's going to help you. You're an independent GP, so you have to invest in your own education, right? So this will not only build your portfolio, but it makes you more valuable and gives you variety in your week. Don't think about if I think about my practice, I might decide to not do anything, but I'm thinking about where I'm going after now. So you need to be valuable to anybody. They don't have to doubt your worth. Okay, so also one thing I've also realized is most GPs don't have indemnity. Please don't rely on Crown indemnity. You need to have your own separate indemnity from day one. Do not skip this step, is your safety net. And lastly, don't isolate yourself. General practice can be very lonely if you let it. Join a group, make friends, build a support network, speak up early if something isn't right. I'll come back to this point. Don't wait until you're overwhelmed. There's always support available, but you must reach out. Please don't wait until you're overwhelmed. Don't just try to speak up early. Most people don't speak up early. It's after they've tolerated a lot of abuse and disrespect from their practice and they start talking. You don't have to stay in a place where you're not valued. If your practice, they are not treating you right, leave, please. I'm telling you, just go somewhere. You can be looking for a while and find. So you don't have to be in a toxic place. You will not grow as a person. You will end up being burnt out. You will affect your personal life. You will affect your life. So you need to always be in a place where you're allowed to flourish. Those people who want to intimidate you, they can eat their practice. They can do whatever they want. You don't have to be there. You are giving people permission to treat you anyhow. No, please don't. You are a valuable professional. So if something is happening, speak up immediately. I'll give you an example. We have a practice meeting every Wednesday, right? I'm on call on those Wednesdays and they want me to attend because I'm deputy safeguarding lead. Like, fine, I can do that. I'm happy to attend because full-time GP, one of your salaried GPs. But then I had discussed with them not to book me a patient, face to face just immediately after the meeting, because then I struggled to catch up. And that had happened several times. And I'm like, if I leave this, it's going to keep happening. So I spoke up and said, sorry, I've told you not to book a patient to come into the surgery. But some people be like, oh, let's just leave it. I can't leave it because it's going to end up affecting me. One day the meeting is going to run over and that patient will be waiting and then it becomes my problem. Do you understand what I mean? I'm also not happy with it. Fundamentally, I'm not happy with it. I'm not saying you can't bend backwards over or do things for your practice. Yes, you can. But then there is a difference, a thin line between people taking advantage of you and you actually just being helpful. And I think that's what we've been conditioned to do in the NHS, just bend backwards over whether it helps you or not. But no, please, if you're not happy with something, speak up. The worst they can do is say, we're not employing you anymore. And that's fine. I said it. That's fine. Anyway, maintain your boundaries and professional confidence. I know the climate in general practice is quite rough. People are speaking ill about GPs. They've been speaking about GPs for a long time. That's not your business. You're not the problem. Government is a problem. Anyway, but you're a professional, you deserve to be treated like one. So please don't take nonsense. Don't allow unsafe expectations. Don't let anyone intimidate you into taking on more than you can safely manage. Advocate for yourself. You've trained for years. Own your space with confidence and dignity. Your first year as a GP doesn't have to break you. Okay? With the right structure, boundaries, learning, and support, it can actually be empowering. Remember, plan your working life, set safe limits, keep developing, build your portfolio, protect your well-being, ask for help, and demand the respect your professionalism deserves. You've earned your seat at the table. Now, work in a way that sustains you. Okay? Until next time, it is Dr. F. Please follow, let your friends know, and you can tell me what you want me to talk about, my experiences. I'm happy to share. So thank you for listening. Share with your friends. Make sure you follow my channel for more. Anything you want me to talk about, I'm very open to. And until then, take care of yourself. Make sure you protect yourself from the cold and be good. Bye.